Hi there, my name is Ethel. I am a psychiatrist and a senior lecturer with Makerere University Department of Psychiatry, and I am the principal investigator for the social, emotional, and economic empowerment of persons living with HIV/AIDS, with depression, through knowledge of group support psychotherapy. We have been in Gulu District to conduct the first ever group support psychotherapy training workshop for primary care health workers working in HIV clinics. The purpose of this training is to equip these health workers with knowledge and skills to help them be able to diagnose depression among persons living with HIV/AIDS and be able to differentiate between mild and moderate depression and severe depression. The counseling intervention that aims to treat depression by enhancing social support, positive coping skills, and income-generating skills. The income-generating skills are targeting poverty, which is a known risk factor for depression. And we're training you to be a good facilitator.
What are the signs and symptoms of depression? The reason why we ask them what is depression, because you find that these clients, they have different perceptions about depression. Majority believe that depression is not a mental health problem. Some think that depression is just thinking about something. Some think that depression is not an illness. So when we give them these questions, they come up with so many answers. Then later on, we talk about these answers.
Why do we believe that GSP works? This slide is important. This is the reason why GSP works. GSP works because first, some people get medication that they don't improve because the social and psychological aspects are not being addressed. That's why it is important to be aware of situations as a health worker. What situations can lead to depression? Group support psychotherapy. Because we believe that somebody's socialization plays a very big role in them getting depressed. But if you improve that support, which comes socially, then the depression itself can lift because it came from social things. That's why it is the third aspect, which is social. And GSP gives an opportunity to do
this. This is a competence-based training in which we want the health workers to gain competence in initiating contact and rapport with persons living with HIV/AIDS. We want them to have competence in screening these patients for depression and be able to differentiate the mild from the severe and be able to refer severe cases. We want them to have competence in using the GSP manual to be able to conduct a group support psychotherapy sessions. And on top of that, we equip them with skills to care for their own emotions, emotional self-care.
I am Roma Lilian, working with Gulu Military Hospital. I've been able to learn how to counsel someone come out of depression, excessive worries.
Lakini tutakusaidia utoka kwa ile mawazi ya mafikirio sana, ile ambayo itakupoteza na uko na afika fadhali nikufe, mchanga mfanye nini? Amekufa. Umenifahamu?
I also learned some livelihood skills that is going to empower a lot of people and myself.
I have learned how to screen and identify a person who really has depression, and especially those ones that are suffering from HIV/AIDS. I have also learned how to actually conduct counseling, and which was lacking in me. And I believe the benefit that I have, I'm going to promote to take it to the community who really need it.
My name is Kizito Wamala, and I am a clinical psychologist. GSP itself is as well built on the principle that the group itself is the vehicle for healing of the individual group members participating in GSP. Therefore, the individual characteristics, the individual aspects of the group members do not take precedence, but the characteristics of the group take precedence.
And also we wanted them to have skills in teaching patients positive coping skills, problem-solving strategies, as well as coping with stigma.
We say that coping refers to specific efforts. You see, they can be mechanisms, like what you have said, and sometimes they can be behavioral or they can be psychological. How we behave, or sometimes how you think about something that you can use to help you tolerate.
We were very impressed with the health workers who turned up for the training. That they were very keen and enthusiastic about the material that we gave them. The best parts of the training were the role plays.
I would like also to assure you that to let you know that group therapy is initially a treatment. It's just a treatment to help us in our recovery, and it's going to be without any financial support given to the group member.
I am so stressed. For over 2 years, I got married to a man. I gave birth to a child with hydrocephalus, and this man is hurting me. And I'm really afraid of even giving birth to another child. I think the same thing may also happen. What can I really do? I don't know how to help this.
Just of recent, I was chased out of my job. Right now I don't have job. I have children, they're at school, but I don't have school fees for them. Right now I'm in dilemma, I don't know what to do. So the other problem is small, mine is big. How can you help me or how can you help me?
From day 1 of the role plays up to day 5, we saw participants as progressively improve in their skills of communicating with someone with a problem. So at the end of this training, we are confident that these health workers are going to be successful GSP facilitators. And they're also very eager to go back to the health centers and start to help people. We have a plan to have supervisors check in on them with every session to guide them as they give these groups for the first time, as they lead the groups for the first time, so that in case they meet any challenges, they can immediately be addressed by the supervisors. With the training they've had in the workshop and the practical training that they're going to be having in the field, this will strengthen the knowledge and skills that they have learned, and hopefully they will go on to train the lay health workers in the villages so that they too can acquire the knowledge and skills to deliver group support psychotherapy to persons with HIV, AIDS and depression in their home villages.